Focus, ideate, innovate, enable.
As far as healthcare is concerned, there are two Indias. At one end of the spectrum, there is this world-class hospital that caters to people who can afford them. At another end of the spectrum, we have poor people who cannot afford basic healthcare facilities. So how do we bridge this to India? That is our talking point. Joining me on the show is Mr. Bhargav Das Gupta, MD and CEO of ICICI Lombard. Mr. Bhargav, welcome to the show.
Thank you, Ravi.
Okay, I believe Mr. Modi wants to make healthcare a fundamental right. As a stakeholder, what is the sense you get reading the draft National Health Policy 2015? Do you think it will alter India's healthcare landscape?
Look, if you look at the first 60, 70 years of India's, independence, the entire thrust in terms of providing healthcare to the poor from the government side was to play the role of a provider, where government set up PHCs, set up CHCs, district hospitals, large hospitals. Clearly, we realize that that model doesn't seem to have served us well. And we are beginning to see a move away from the government becoming the provider to the government becoming the payer, where government is saying that I will finance the healthcare, but it can be provided by private sector, providers. Now, the issue thereafter is when you're looking at government financing, do you do a model which is direct in terms of government buying directly from providers, or do you do a model where there is an insurance intermediary, and both models work globally? So if you see what the government was trying to do in the last maybe 6-7 years was where they brought in an insurance intermediary, because the role that insurance intermediary plays is that government basically passes on the risk to the insurance company. So let's give you an example. So today, let's say the government says that for all the BPL population, I want to provide an healthcare coverage for both primary care, secondary care, tertiary care. I can afford to spend 1,000 rupees, right? And they give that money to an insurance company. Now, this could be done through a bidding process, which is what used to happen for RSV. So by doing a bidding process, government gets price discovery, because all of the insurance companies bid, government quantifies the amount and the best price, goes to the government. Now, once the risk has been transferred, because now it's the insurance company's risk, the insurance company is responsible for few things, which is in terms of enrolling people under the scheme. That's a huge task, because if you look at the 600,000 villages in this country, that's a very, very large task. Second thing is, post-enrollment, at the time of treatment, there is a big role that the insurance companies play, which is in terms of controlling abuse, misuse, overuse into the providers. And that's a big role that the insurance companies play. So I think the way that government needs to look at this whole architecture is, while they should become the payer rather than the provider, I think there is a very important role that insurance companies play in terms of controlling some of these things. So if you expect the government to do these things, there is a lot of capability building that is required.
But another big development from the patient point of view is that government has bought some 450 drug formulations under price control. Now, I also understand they are planning to revive Jan Aushadhi pharmacies. And the government is going to concentrate on 40 to 50 drugs which are mass consumed. Do you see this will bring the out-of expenses of patient drastically down?
No, Ravi, personally, I think this is a very, very positive development. It should bring down out-of-pocket expenditure for patients, particularly for that, strata of patients who need that kind of
I was also told that doctors will have to prescribe generic drugs, not brand names.
That's a very important point. So if you want to see this succeed, there are 3-4 things that I think are important. First, you have to have the network created. So that's a...
They're now taking sometimes 3,000 pharmacies.
The hardware, so many pharmacies out there. You have to have people who are willing to distribute these drugs. There has to be some adequate incentives for them to distribute.
True.
Third thing, the quality of these drugs has to be, in spite of them being generic doesn't mean poor quality, but the quality of the generic drugs has to be good. Because at the end of the day, you're talking about patients' safety. Finally, and that's the most important thing that you touched upon, you have to get doctors to prescribe generics. Because at the end of the day, my understanding is that if a doctor prescribes a branded drug, the pharmacist does not have the liberty to change it to a generic. So that compliance, my senses, will be the toughest. But it's very important to move in that direction so that we get the benefit of these Jana Aushadhis the government is
But
trying.
generally, the pharma company, generally, you go to a chemist, if one particular brand is not, he tries to push another brand, but he doesn't try to push you the generic brand.
Exactly.
So you think he should be
Exactly. So the prescription also has to be a generic.
prescription to be generic. So net things are looking good in the healthcare space as of now.
I think there is, in my mind, a lot of thinking going around in terms of how to design or rather redesign our healthcare delivery system. I still think there is probably a bit of lack of understanding on how to design it in a more sustainable manner over the long period of time. Focus on health rather than sickness. I think the mindset that we always have, and this is a global phenomenon, not just India, but globally people are changing. I think that the change has to be to move away from thinking about sickness benefits to health benefits, which means a lot more thought about preventive.
The preventive part.
The wellness, the primary care side, the entire network where you incentivize people to ensure that their population that they're catering to remains healthy rather than just treat them for sickness. I think that element needs to come through.
So the new government is aware of all these things and they are taking steps in the right direction. Would you say that?
I would say that. Largely it looks like that.